Welcome, folks. And on today's Hard Issues episode, I'm sitting down with Chantay Harrison-Crawford about her experience with suicide. Hello there, Ozzie Stewart here, and thanking you for tuning in to our Hard Issues segment. And on this episode of our On the Call Podcast Network experience, we're shining light on Chantay Harrison-Crawford, whose health issues or health experiences or experiences in general led her to suicide. So please like, follow, share, comment, support us, donate, become a member. We have a store with items, real items. And now we're going to get to it. Before I do, I'm going to let you know a little bit about Chantay. Chantay Harrison-Crawford is a resilient 35-year-old woman who navigates life with sickle cell anemia, liver disease, and various medical complications stemming from the sickle cell disease. Despite facing immense personal challenges in 2019, she courageously founded Tilted Crown One Incorporated, a testament to her strength and determination. In 2023, Chantay confronted rock bottom moments as she grappled with her own and her daughter's separate suicide attempts, triggered by toxic relationships within the family and circle of friends. Through adversity, she founded a renewed purpose after a divine intervention during her second suicide attempt, leading her to dedicate herself to transformation and following a higher calling. As a mother, professional, wife, and entrepreneur, Chantay now channels her energy into fostering mental and emotional well-being. She initiated the Royal Bible Study Program, aiming to empower women towards self-love and care, building on her commitment to serving others. Concurrently, she extended her compassion by offering shelter to 2 homeless individuals from Illinois. Chantay's past initiatives like Wisdom Wednesday, documenting stories of sickle cell warriors, and providing community support reflect her altruistic nature. Notably, she has also launched programs such as Melanated Warrior and PMS, which stands for Pray and Manifesting Ish, emphasizing natural remedies for sickle cell anemia and hosting relatable discussions through a weekly podcast. Embarking on a new chapter, she is set to release her first book under She Rises Studios, expected between November of this year and January of next year, marking a significant milestone in her journey of resilience and empowerment. Her social media presence on Instagram as @katika.33, TikTok as @dearkatika.333, and podcasts on iHeartRadio, Apple Podcasts, and Spotify under Dear Katika, Katika spelled Katica, showcases her commitment to sharing experiences and insights. Now we're going to speak to, or with, Chantay Harrison-Crawford. So what inspired you to establish Tilted Crown I Incorporated, and how has this venture evolved since its inception in 2019?
What motivated me to create Tilted Crown Incorporated was me listening to experiences, loved ones, or just the community are dealing with, whether it was financial, whether it's generational curses, whether it is relationships from parent to child, just different experiences that shape people and individuals. And a lot of us tend to self-sabotage, whether it can be drinking, whether it can be using substances that's not good for our body, or even just think negatively and harming ourselves And I wanted everyone to focus on the good of life. You're waking up each day, and sometimes experiences may cause our crown to tilt, but it would never fall. Understanding that we are all kings and queens, depending on your age, we're prince and princesses, but you will always have to experience some form of trauma and hardship in life, but it doesn't mean that you have to allow that trauma to override you and take control of who you are as a person, who God created you to be. In 2019, we, as the world know, we shut down, and a lot of us was not used to that. So a lot of trauma, a lot of problems surfaced. And I think since then, mental health and emotional health and well-being overall have risen from where we didn't really talk about it. Now we talk about it every single day, and I think they miss the middle. A lot of us miss the middle where, yes, we experience it, and it's good to talk about it, but it's also good to understand it, so then you can know how to control it, so it won't continue to fall on the next person, or we become codependent on each other to where we expect the other one to have control over our emotions. I want all of us as humans to have that control and love ourselves, because there's always something to love.
How do you balance the demands of being a mother, wife, business owner, and dealing with the complexities of sickle cell anemia, and liver disease?
Honestly, I stay focused on my purpose. I understand that those are titles, and that's not who I am. So I've learned, because I have not always been able to manage all. In some cases, my relationship with my daughter would suffer, my relationship with my job, or even myself, or just in general, all of the titles may suffer. And I had to take a step back and understand that although I do wear those proudly, I'm not always obligated to put everything first before myself. Learning that it's okay to say no at times. Learning that it's okay to say, I need 5 minutes. I need to breathe. I need to cry. It's funny because out of both sides of my family, I'm the most sensitive one. And for years, that tormented me, because imagine hearing, why are you crying? Don't express yourself. You grow into that, and then subconsciously you allow others to quiet you and allow them to dim your light. And when that light is dim, it's dark, you can't really see, you can't find yourself, so you become angry. And you lose sight on what's important, which is you, which is the relationship with God. So I just learned how to put God first.
What are the symptoms? What are the symptoms that you experience with sickle cell? That is, what does it look like, so people can understand what that is?
So it's like my body, I can sit one day on a Monday, and then Tuesday, my whole body shuts down. It can start hurting. My red blood cells are shaped like a banana, like a sickle. So they become sticky and clogged. And once that happens, the blood is unable to go through my veins. So it causes pressure and pain, and stiffness. So then my arms would start hurting, or I would begin to walk with a limp if the pain is in my leg. These past couple of years, I've been experiencing where major organs, such as like my heart or my portal vein, will be infected by an infection. Like my respiratory system is much weaker than others. So I'm more susceptible to colds and my like recently I've had a port. I have a port, and my port.
What is a port?
A port is a device that is connected to your portal vein by your heart, and it allows you to receive medication as well as do blood, and it helps connect to major arteries and the veins in your body. Because most sickle cell patients, we have very tiny veins, like an infant vein, and sometimes we have to be stuck several times just to get IV fluids. I've experienced being stuck in my neck, being stuck in my foot, where they have to get the IV machine and still have difficulties with finding a vein. So a port helps that process of being in the hospital, and you imagine also being in crisis and you're constantly being stuck and you're not receiving the medicine or the things that you need. It can be very, very hard on your body. The pain hurt. It feels like stabbing or like throbbing pain, and it just comes out of nowhere. We were born with this. We don't know why, we have it, or where is it coming from, but it creates a lot of.
Did that affect you where you now have liver disease? And which one came first, the sickle cell?
Sickle cell.
And then now you have
it affected my liver. And where it affected my liver is I have cirrhosis on my liver. And the cirrhosis has attacked, like covered my entire liver to where, a liver can regenerate. So it's not like they can cut some of my liver and have it grow back. It affected my entire liver. I have a benign tumor in the center of my liver, so they cannot cut around it or I will have internal bleeding. Right now, I am in need of a liver transplant, but because of my sickle cell, I'm a special case. My liver, specialists often bring me up in the meetings, the important meetings, because like I said, I need a bone marrow transplant and a liver transplant. I cannot do a liver transplant without the bone marrow because the new liver would be damaged all over again. I cannot do the bone marrow transplant because I wouldn't survive because of how weak my liver is. Because I have to go through chemo radiation with the bone marrow transplant. My body wouldn't be able to handle it. So,
what lessons have you learned from your experiences with toxic relationships, and how have they shaped your perspectives on self-care?
I learned no matter how hard you try to satisfy others, they will never be satisfied until they're satisfied with themselves. So the most important thing is I learned not to overcompensate who I am. I learned not to allow others' opinions to affect me so much so that I begin to change how I view myself, how I love myself. I learned how to accept how emotional I am. I've learned how to accept that I may not be the smartest in the room, but I would be the most motivated. I've learned how to just accept me because I lost that. I lost her. I lost myself.
With that comes, what kind of challenges did you face with healthcare professionals and medications and the after effect treatments?
I've experienced so much turmoil, so much trauma with dealing with healthcare professionals because we are often dealing with professionals that do not share the same background as me. And they are often critical to things that they don't understand or really took the time out to study. And I say that because in the textbook, a lot of doctors, they come up, they study, how to be a doctor, and sickle cell anemia will only have a chapter or maybe a page within a chapter. And it doesn't really give them a broad idea of how to care for us, how to understand that just because I may not cry doesn't mean I'm not in pain. And I often receive those type of attitudes to the point where I was actually told by a doctor that I'm an addict and that they wrote on my chart I need the methadone clinic, all because I take medication that
They prescribe, right?
they prescribe, and that is not normal for them to take. And they often would say, well, you're not crying, you don't seem like you're in pain. And I said, well, how do pain supposed to look on me? Because I wouldn't come to the hospital if I didn't need this medication. I don't think people understand. We don't like, most of us don't like, taking this medication.
Right.
There's after, effects to the medication. We have to deal with constipation. We have to deal with emotional rebalancing. Because when you take that, it shifts who we are. Either some of us become angry and some of us become, quiet. It just shifts who we are as a person. We have to deal with rebalancing mentally after we come from the hospital. And I don't think they really, really understand that being born with a disease that you never asked for, you never did anything in life to get this disease. It's not like I did drugs and boom, I have sickle cell anemia, or I was promiscuous and I was born with an illness that I have to learn how to live with, how to understand, how to even explain what I don't even understand. And I come to you for help and you criticize me or you don't listen to me. I remember what really led to my downfall or my breaking point was when a nurse didn't listen to me 2 years ago. Almost 2 years ago, I was in a hospital in Yonkers, New York, and a nurse would not listen to me when I was informing her how to properly de-access my port. De-accessing my port is removing the needle, the central needle that goes in that provide the medication or the blood work, etc. She would not listen to properly disinfect the area where the port was positioned, as well as wear disinfectant gloves, etc. Not realizing that she put a virus in my port. That was January. The next month, I went for treatment, and within 30 minutes of my treatment, my whole body shut down and I passed out. I came to a few hours later, to which they had to call my husband. My body, I could not move. I could not walk. My body was breaking down. I didn't realize at the time that I was dying. They took me, the EMT where my home was located. I have to go back to the same hospital, which at the time, I didn't know that, it was what she did, what caused it. But I went there, and the moment that they did blood work, they admitted me and I had to go rush to ICU. Come to find out, there was an infection in my port that when my port was reaccessed the next month, it pushed the virus further into my chest area. And that's when the virus started to take over my body. I was in the hospital from February until April. The same hospital, within the first 2 weeks of my hospitalization, they stopped the antibiotics that was healing the virus. They stopped the antibiotics and my body started to shut down again. But they refused to add more antibiotics because of the medication that I take. I take Dilaudid, which is very strong and it helps with pain. at that time, that is the only strong medication that would help my body, my system get help with the pain. So I had to make a life-changing decision with the port that they accessed. My husband was out of work. I called my doctor. My doctor, she already knew I was in the hospital. She was trying to give me a transfer. They did not do the paperwork on their side, the hospital I was in, to complete the transfer. So I called her when I knew my husband was off, and I asked him to pick me up from the hospital, and I went down to the city to my hospital. The moment I went into the ER, they rushed me in, and I had to go back in ICU because the infection got worse because they stopped the antibiotics, and that was the most of the length I was in the hospital. I was in Wells Cornell Medical Center, and I got better, and I was happy that I made that decision, because if I would have stayed, I wouldn't be sitting here right now. And this is what my third time speaking out about this. I didn't get an apology or anything from what the nurse did. It was always my fault.
You spoke about traumas with family that got you to the point. So we'll talk about the point later, but what sort of traumas led you to that point?
The relationship with my parents, I didn't have one.
How many children?
It's with my dad, it's two. Well, both sides is two, but I'm the oldest on both. I didn't understand, or at least I didn't understand, or at least try to understand what the experiences my parents went through, because they had a rough upbringing, and my parents they're very strong, and they're not really into showing that much emotions. And you have a child that does show emotion, so it was a lot of clashing. So it was not having a good relationship with my parents, not having a good relationship with just my family in general. And
Siblings?
I have a sister. We're not as close as I would like. I have a little brother, but he's 5. I have cousins. We don't talk. And my aunt, the relationship has went is not the best. I do have my aunt on my father's side, but she lives in Maryland, so the relationship is not, we're not as close.
So what was it within that relationship, that body of people, that got you to the mental state that you got to that point?
I felt alone. I felt misunderstood. It was,
Because you were born with sickle cell.
yes.
So they had to be there throughout your journey with sickle cell. Was there a conversation about
My sickle cell, at one point, my family, it was mentioned to me by my family, are you sure you're experiencing the pain, or is it the medicine? You can talk to me. And I don't think they realized that question, what it did to me. It made me feel like, you too? Like, who's there to believe me, especially when you're family and you're kind of the reason why I have sickle cell, because it, both have to have the trait in order for your, child to have the disease. So I just felt alone. I felt alone.
Looking ahead, what are your aspirations for your upcoming book release?
I'm hoping to shift the mind of the world, to look at life in a different way. I want people to understand who I am. I want to know who I am. I want people to understand that there's always a way. It doesn't matter what you're going through in life. If you sit back and allow yourself to smell the coffee or to make that lemonade with those lemons, you will see that there's always a way. And the way can be the smallest thing, but it's always a way. And that's the beauty of it. It's the beauty of life.
What has inspired the creation of initiatives like Melanated Warrior and PMS?
Yes. Melanated Warriors, me understanding, I don't have a background in the medical field professionally, but I do have a background as a warrior, as a survivor, as someone that is actively going back and forth in the hospital. I want and I will create a facility or just a center where anyone, I'm mainly catering sickle cell anemia, but I'm opening the door to everyone because everyone needs care, where they feel loved, they feel cared for, they feel like they're not alone. I would like to create another avenue to where naturally we can use plants as medication. This disease was out for hundreds of years. How did our ancestors, survive to get to, where we at now without having the science to back us up? So let's go back to where it all began. Once you do that, you begin to understand how to create and navigate a different beat.
That being said, what kind of natural remedies are you using now?
Right now, I drink a lot of water, and beet juice is really good for the blood. There's also, I use detox to flush out like lemon water. I drink a lot of tea. I replaced a lot of like sugar or anything that's man-made. I've replaced that. I do a lot of walking. Now it's not perfect and I'm still learning. However, I do like maybe hemp seed for pain. I will, rub the hemp seed on a area where I'm in pain. I will create my own like shea butter lotion.
Why would you create your own? What's wrong with the stuff that's out there?
Not
that I know much about it.
No, I just feel like a lot of things are chemically made and they're putting extra. And even if it's saying organic, or there's always a fine print. Why, if it's organic? Why do we have to read the fine print? I don't understand that. And it's also in like what we take in, like the lotions and things, all that seep in our body and our blood and our cells, that is feeding off of that. And if we're putting less things in our body have the chance to naturally grow.
So what other natural things are you using?
Honestly, I let the pain, like if depending on where my pain level is at, if my pain levels, the scale, if it's 1 to 10 and my pain is at a 4, I would take a nice hot, bath with essential oils. I like peppermint oil. It brings a little cooling and it's like that icy hot effect. I do like the icy hot effect. Things like that. It's not necessarily like medication, right, but like different foods, like even greens. Eating right, you have more energy. You have natural energy. I use the aloe plant for my skin, or like I eat a lot.
Which is beautiful, I gotta tell you.
Oh, thank you so much. I do like a lot of it's different natural incorporations that keep me level, and then most importantly, I pray.
Pray. Okay. So you guys have a sense of Chantay, what she's going through health-wise, physically, what she's been going through mentally. And when I spoke to that point, what those experiences, how those experiences led her to attempting suicide twice. We're going to get more into that on the next chat, on our membership page, on ITC Inside the Call. So thank you very, very much, people, for taking this time to love on this spirit. Thanks to Cheese, the OTC team, to my audience for spending your time. Please, your valuable time. Thank you. Like, follow, share, drop a comment, donate, the store, the merch, all of that stuff. And Chantay, thank you very, very much for sitting here and opening up about your life and sitting here in a minute for the next conversation. And as I always say, guys, when you're on your beat, stay on the sunny, sunny side of the street, safely, be health conscious, kind to one another. And don't forget to give thanks for the little and big gifts as we strive through and to this beautiful life. See you on Inside the Call. Chantay Harrison-Crawford coming up next.